I'm Faith Dabney. Do you have a loved one that has been affected by cancer? Do you ever wonder how it is caused? Well, according to the National Breast Cancer Foundation Association, breast cancer is when malignant or cancerous cells are formed in the tissue of the breast. 1 in 8 women are diagnosed with breast cancer in their lifetime. This just helps show that one of the most common cancers that is diagnosed to women is definitely breast cancer. Breast cancer is caused by a variety of different aspects, but one of the biggest ones to look at is genetic mutations. Genes can have effects on breast cancer, but in order to figure that out, we first need to look into how it works. A huge cause of breast cancer are everyday aspects. Dense breasts are a very good example of everyday aspects. When one has dense breasts, they have more fibers and glandular tissues in the breast than fatty tissues. This automatically will increase your risk by 1.5 to 2 times as much. Another reason why this is terrible to have when you have breast cancer is because your lumps and tumors won't show up as well on scans and mammograms as they would if you had a regular dense breast. Another huge cause of breast cancer is early menstruation. When one starts menstruating before the age of 12 and up until the age of 55, it will increase the risk tremendously. This is due to the fact that they are overexposed to the 2 hormones estrogen and progesterone. These are just a few examples of the outside factors that can cause breast cancer, but there are also a number of more specific aspects. An example of those specific aspects are a history of cancer within your family. Women that have relatives that have been diagnosed with breast cancer are automatically at a higher risk. But women that have first-degree relatives, such as a mother, a daughter, or sister, that will increase the risk by 2 times as much. And if you have 2 of these same relatives that I just mentioned, it will triple the risk. Personal history is also a very good thing to look at when dealing with causes of breast cancer. If one is diagnosed with breast cancer, previously they will have either a reoccurrence in the same breast that they had it before but in different parts, or in the other breast. Also, you are diagnosed with breast cancer at a young age. It is more than likely that your cells were harmed in that process, and so if you have a reoccurrence, your cells won't be able to fight off the new diagnosis as well as they could have when they were younger. An increase in risk can determine your entire future with dealing with breast cancer, but so can genes. Genetic mutations are also a very big cause. BRCA1 and BRCA2 are the most common hereditary genes. According to American Cancer Society's medical team, on average, a woman with a BRCA1 or BRCA2 gene mutation has about 7 in 10 chance of getting breast cancer by the age of 80. The risk also is affected by how many other family members have had breast cancer. This gene is more likely to end up with younger diagnosis and breast cancer in both breasts. Although this is a huge genetic mutation, there are also many other common ones. A few examples of these are ATM, TP53, CHEK2, and many, many others. When one is having genetic mutations, they should consider genetic testing as an option. But there are pros and cons to genetic testing, and it is suggested that by doctors, they should look at the pros and cons of each side. Many factors can cause breast cancer, but many just happen naturally. There are a lot of causes to breast cancer, such as everyday aspects, family history, and genetic mutations. A huge reason why everyday aspects are so important is because they are very common in parts of breast cancer. I think one should remember that when they're dealing with breast cancer, it is just out of your control. One should look at the whole picture and remember that there's a huge variety of reasons of why breast cancer is caused. Just because you're dealing with breast cancer doesn't mean you're completely helpless. One should be diligent in taking care of their body and remember that they're not alone when fighting against breast cancer. Good job, Mom.